Hello, my name is Emily Flav and I'm one of the midwives with the MercyOne Des Moines Midwifery group. The presentation is just going to talk a little bit about COVID and what you can expect in the hospital, and I'll also chat a little bit about immunizations in general while you're pregnant. So because of COVID-19 and the ever-changing information, many people have fears about going to the hospital to have their baby and are even nervous about going into the clinic for their prenatal appointments. You are not alone in this. MercyOne has taken steps to limit the spread of COVID-19 and to keep people safe. Hospital and clinic staff are following guidelines from the Centers for Disease Control, or the CDC, including things that we had already been doing, such as frequent hand washing, not coming to work when we're feeling ill, and maintaining clean spaces. We've also had to add in a few changes, though, because as we all know, COVID has been ever changing. We have had to make some restrictions on visitors, so we are not currently allowing any visitors in the hospital. You are allowed to have your one support person in labor. That can be your significant other, your mom, whoever you choose to be your support person in labor. They are allowed to be in the hospital with you. We are also allowing for a doula who is certified to come with you and be a support person for you in labor, in addition to your other designated support person. So those are a couple things to just keep in mind. We encourage all patients and their significant others, or whoever their support person may be, to monitor themselves for signs and symptoms of COVID and get tested if you have symptoms. Currently, we are encouraging all birthing persons to get tested for COVID when they are admitted to the hospital. We are doing a nasal swab that is a rapid test that will come back, obviously with your positive or negative. It is especially important for you to get that swab done, that COVID test, when you're admitted if you're considering using nitrous oxide as a method for pain relief while you are in labor, because that is a requirement to have a negative COVID on file to use the nitrous oxide. Another concern that you probably have had or may have heard is, will your baby get to stay with you if you test positive for COVID? So your baby will get to room in with you regardless of your COVID test results. There are only a couple cases where the baby would not room in with you, and one of those would be if you were too ill to care for your baby, then baby would be taken care of elsewhere, or if the baby is requiring more supervision for another reason unrelated to COVID, where they would need to go to NICU or be monitored in the nursery. We are also not currently allowing parents into the nursery when baby goes in there, just to keep all of the babies safe and limit their exposures. In these instances, your medical team is going to communicate with you every step of the way. Our goal is to keep moms and babies together whenever possible. And if you do test positive for COVID while you're in the hospital, you and your support person will be restricted to your room with your baby for the duration of your stay. With all of these changes, along with all the other day-to-day changes that we're facing, this may seem scary, but just remember, we are looking to keep you and your loved ones safe and healthy. So just to kind of sidestep here, we know there's not a vaccine for COVID currently. There is one in development, but there are other vaccinations that we recommend during pregnancy. The first one is the Tdap vaccine, or the tetanus, diphtheria, and pertussis vaccine. So the Tdap vaccine is recommended in every pregnancy, primarily due to that pertussis part, or what's also known as whooping cough. By giving mom the vaccine, she makes antibodies against whooping cough that she then passes to her baby through the placenta, and that passes that immunity, that protection, onto baby until they're old enough to get their own vaccines. The other vaccine that's recommended in pregnancy is the flu vaccine. The theory is the same as with the Tdap vaccine, that by giving mom the vaccine, she creates antibodies against influenza and then passes them on to her baby and provides baby that protection. Both of these vaccinations have been studied extensively and are safe in pregnancy. A few great resources, though, for you to do your own research, so you don't just have to take your physician or your provider's word for it. You can look on Mayo Clinic. You can look on the Centers for Disease Control, or the CDC website. You can also look on the American College of Nurse Midwives website. They all offer great resources that are evidence-based and can show you research studies for how safe these vaccinations are in pregnancy. Ultimately, it is up to you to make the decision for what is best for you and your baby. As providers, our job is to ensure that you have the most accurate and up-to-date information so you can make those decisions for yourself. In general, I encourage you to talk with your provider about any questions or concerns that you may have, or any fears that you may have about surrounding your prenatal care, going into the hospital, anything like that. That way you and your provider can work together to develop a care plan that's going to work best for you and your family. Best of luck in your pregnancy, and take care.